This session, Iowa legislators are hoping to increase mental health resources through 4 bills. Local 5's Mary Sugden spoke with the lawmaker who introduced the legislation and explains what's included.
Representative Ann Meyer says she's heard countless stories from constituents on their struggles to access mental health resources across the state. She believes these 4 pieces of legislation can help fix that. Representative Ann Meyer says Iowa ranks 44th in the country when it comes to psychiatrists per capita. Her first bill aims to change that.
We want University of Iowa to establish 12 psychiatric residencies throughout the state.
It's a cost of $1.2 million for year 1, doubling to $2.4 million in year 2 with the addition of 12 more residents. The second bill establishes a loan repayment program for psychiatrists, nurse practitioners, and therapists who can prescribe. They'd be required to stay in Iowa for 5 years, and with more staffers, Meyer wants to add more beds.
Increasing the number of beds at our 2 mental health institutes, Independence and Cherokee, by 50%, which will be an additional 34 adults and 12 children.
When we're doing a $300 million corporate tax credit, when we're starting with $1 million for mental health. So it's a start. It's kind of a drop in the bucket. So I would love to see more.
Timmy Brown Powers serves on the Human Resources Committee with Meyer and says while she's excited to work with her on these pieces of legislation, she'd like there to be a bigger funding guarantee.
And it's going to be guaranteed for those programs going forward. It's not going to disappear in a year or 2.
And that 4th piece of legislation would establish a reimbursement rate for higher, more complex need patients. Meyer says that reimbursement rate would likely be higher for doctors, again in an effort to keep them here in the state. Reporting in Des Moines, Mary Sugden, Local 5 News. We are Iowa.
These proposals are just making their way through subcommittee. We'll keep an eye on their progress, let you know of any adjustments made by lawmakers.